Hello, everyone. My name is Marty Guthmiller, and I am CEO of Orange City Area Health System, bringing you today the 48th edition of the COVID-19 Community Briefing. This is our second briefing this week, and so I'll be reviewing some statistics and comparing that to Monday. And so we're going to start today with the Sioux County statistics. Sioux County has 724 positives. That is plus 31 since Monday. We've tested 4,966 at this time. That is a positive rate of 14.6%. To be honest, that's one of the few positive numbers I'm going to give you today. In that number on Monday was 14.7%, so 14.6 is technically better. But the numbers that we're going to share today are not generally very good, including the fact that there's been 31 positives since Monday. We're going to jump then to Region 3. Region 3 has 43 hospitalized patients currently. Region 3, again, is the 20 counties in Northwest Iowa. That number on Monday, when we talked, was 38, and the number before that, on the briefing before that, was 23. So we've had a rather significant increase in the number of hospitalizations in Region 3. There are 10 patients in Region 3 in the ICU currently. Again, that number has gone up. When we spoke on Monday, that number was 8, and the time before that was 4. Of those 10, there still remains 1 patient on a ventilator, so that is a good news in that it's not more than that. But 1 out of that 10 is on a vent. 8 patients have been admitted in the last 24 hours. So this number of the hospitalization has jumped quite a bit since just yesterday. Iowa has 53,990 positives of the 581,514 tested. The website coronavirus.iowa.gov indicates that that's 1 out of 5 Iowans. Maybe it is, maybe it isn't. I still think it's 581,000 tests, not 581,000 Iowans, but that's a small point at this time. That is a positive rate of 9.3%, which is slightly better than it's been for quite a few times at 9.4. It might be a good time to mention also that there's been some discussion out there, some reports that some of the numbers on the coronavirus.iowa.gov site are not accurate. I honestly don't know the extent to which they may not be accurate at this point. Supposedly, if you had tested negative previously, let's say, for example, you had tested negative in April and you subsequently test positive in August, it would be recorded as an April positive, not an August positive, due to a snafu in the programming. I honestly can't believe that would be that many people that had a negative test previously and then a positive test. It certainly could be some. And if that algorithm in the program is such, that would not be accurate. And yes, that would change the 2-week rolling average that we've been talking about. And yes, that is significant, particularly as schools open. But again, the extent to which that is inaccurate, whether it's a decisionable kind of difference or not, I don't know. I simply don't know. And so I choose to stay with the numbers with that little bit of a caveat, and that at least I'm cognizant of the fact that there's the potential for some discrepancy out there. Okay, jumping back into the numbers. I still believe that it's very difficult to fake hospitalizations. I do think that if you're in the hospital, it's going to be recorded as such, and that is my single best measure of acuity. It's my single best indication of how sick people are getting. And to me, again, you know by now, it is not the number of positives so much that concern me. It is the acuity level. It's the sickness of these patients. And if they're not sick enough to be in the hospital, there is some measure of comfort for me. And again, you can't fake being in the hospital. And so I think those numbers would be pretty accurate. Unfortunately, those numbers are up. In Iowa today, we currently have 278 hospitalized COVID-19 patients. That number is up from 257, so another 21 since Monday. And that number is up 77 over the last week since August 10, I guess 10 days. So 201 on August 10, 257 last Monday, this previous Monday, and 278 today. That is not going in the right direction. Again, not downplaying that, but it's important to understand what's around us. And so I'm not discounting or not worrying about other hospitalizations in other parts of the state, but first and foremost, I'm concerned about here in our region. Sioux County, as of today, has 1 hospitalized patient. O'Brien County, 1 hospitalized patient. Plymouth County, 1. Lyon County, 0. Osceola County, 0. Clay, 4. That has jumped up to 4. Dickinson, 4 also. Woodbury County, 10. That has gone from 6 back up to double digits now at 10. Polk County actually dropped from 45 to 39, but remains the highest county. Of course, Polk County contains Des Moines. BV County is back up to 3. And more importantly, with the 278, there are now 8 counties in the state that have 10 or more hospitalizations. That number was 6 on Monday. So there's no question about it that there's an uptick in hospitalizations, there's an uptick in positives. It doesn't appear, at least in our area, that the acuity is rising any higher than it's been. In fact, maybe just a little bit down if we could go there. Deaths, 1,014 deaths plus 38 since Monday. Again, the last time I looked at the trend line, I wasn't able to do that today, but the deaths were trending down a little bit. The plus 38 since Monday probably is going to have it trending up a little bit again. The other stat that I've mentioned earlier that I'm just going to give, we have to question a little bit of the accuracy, but I want to be consistent with this, is the percent positive 14-day average. Sioux County is 12%. I think we've been 13, we've been 11, and now we're 12. Plymouth County, interestingly enough, is the highest in the state at 17.7% over the last 14 days. So just another number to keep track of, and we will also keep track of if there's any clarification on the accuracy or how it might be straightened out. I want to end today's briefing by talking further about Dr. Donlan's presentation from last week. If you recall, he gave us an acronym, one that we should be able to remember, right? If we can remember Orange City Area Health System, we can remember OCAHS. And only Dr. Donlan gave us different words, where the O stands for observation, and basically what we choose to observe, what we choose to see, is usually what we see. So if we choose to see good in something, we will likely see good. If we choose to see something less than good in something, that's probably what we'll see. The C in OCAHS stands for connectedness. And just a brief recap of what he talked about with connectedness is that we have to intentionally choose to be connected with what's important to us. that not doing so, to being disconnected, often leads to isolation. Isolation leads to stress. Stress leads to a number of other things. We'll talk a little bit about that further. But choose to be connected to things that matter to you, what's important to you, and intentionally seek connectedness in those areas: faith, family, friends, that kind of thing. So again, that's from Dr. Donlin. We'll talk about the A on the next time. But again, observation, connectiveness, and we'll talk about A the next time. There's no doubt that there's COVID fatigue out there. Now we're even talking about a new kind of fatigue, and that's Zoom fatigue. So for those of us who have been participating in meetings via Zoom, I had a situation the other day where I said, so should we set up a Zoom meeting? And somebody said, let's just do an old-fashioned telephone conference call. And I said, okay, let's do that. But there's no doubt, and how the fatigue manifests itself in our daily activities is very different. We can turn on each other, and that's where we talk about grace-filled lives and being given people some space and giving people room. I think it's also important for you to understand that, you know, we're a rural health system. How do you know that we're really on top of things? How do you know that you know, we're paying attention to the right factors? I think it's important to understand a little bit on where we're coming from and what we're doing, to try to do everything we possibly can. And again, remember that from the very beginning, we said we won't always do things right the first time, but we are trying to do things correct, and we are adapting as we go along. This pandemic is ever changing how we respond and prepare. But it's important for you to understand that we are following CDC guidance. We have a team of folks who read that stuff all the time, we interpret it, apply it to our situation. And it's not just our interpretation and our guidance that we use from CDC. It is also guidance put forth by Sanford Health, and in consultation with them. That is, we work together, not only to protect ourselves from the disease and to make sure that we are here to take care of you, but to protect our communities. And so I think it's important for you to understand that we seek guidance from Sanford. We seek guidance from the IDPH, Iowa Department of Public Health, CDC, and others around us. So we are not going this alone. And I think that's important for you to understand. So as I close today, I just I don't think we can repeat this enough, right? We all always and will always need grace in our lives. I would ask you to give each other a break, and understand that we're all in this together. We ask you to stay strong in this marathon. I've been talking about the marathon, and somebody said the other day, well, I don't think it's a marathon. I think it's an ultra marathon. Well, okay, well, we'll wait to determine that for just a little bit yet. But stay strong in this race that we're running. Stay vigilant in using common sense and proper hygiene and proper social distancing. And above all else, stay healthy. Thank you for joining us today in this briefing.